Hi, I was at MCR. Some of my strengths during my clinicals were breastfeeding education. I think I did a good job of applying what I had learned in class in CEC to my patients, teaching them about the size of the baby's stomach and the different holds and making a C. And an example of this was yesterday after my patient had delivered. I helped her readjust her baby and help her really fill the baby's mouth with her nipple, which was something that she didn't know he had to do for effective breastfeeding. I think I also demonstrated a strength and eagerness to learn and immerse myself on the unit. So during my patient's labor yesterday, I jumped in eagerly without being asked. I assisted in pericare and helped hold my patient's legs when pushing, and I even helped push down the tocometer in between contractions. I think I also did a good job of coaching and anticipating patients' needs. So yesterday I realized during labor that my patient was responding well to signs of progress, like she was moving forward. And so with that, I really vocally emphasized progress and that we could see more of the baby and that things were good signs. And that really seemed to work and be effective with her, especially in her case because she was pushing for over 3 hours and the doctor had even talked about potentially starting a C-section if she didn't progress further. Some of my weaknesses were actually getting the baby to latch. So a lot of times what would happen in my cares would be that the postpartum nurse would get the baby on the breast, and then I would be left alone with my patient, and the patient would sort of expect me to continue to help the baby latch, and I struggled with that. Even though I had the theoretical knowledge in my head, I couldn't actually effectively help them do that. And I think this is specific to the OB population, but it does speak to my occasional lack of comfort in getting really close and personal with patients. And so I think I can work on this by, in care planning, emphasizing hygiene and helping with oral care and helping with showers and baths, just to practice those skills for myself. I think also I was weak in my impatience, so my clinicals were pretty slow. I only did get to see one labor, and most of the time I was on postpartum care, and I think by the end of my postpartum care before the labor that I finally got to see, I was a little impatient and not that present, or not as present as I could be. I wasn't finding as many learning opportunities, and I want to work on this because I understand that labor itself requires patience, and a lot of delivery nurses do start out in postpartum care, so I want to improve on this by committing to sitting with my patients and really having that face-to-face time when things are slow. This is because I think that I am very present when I connect with people, so relationship development can definitely help the curing process even when things aren't as action-focused or I don't have as much to work on. So some of the lessons that I learned included non-judgment. So one of my patients actually had a highly offensive tattoo, a swastika, on her belly, and one of my classmates' patients had been drinking all throughout her pregnancy. My preceptor, who had been doing this for years and years and years, really emphasized how judgment does nothing in the treatment process, and how it's not going to cure the baby or the mom. And I want to carry this into my future time as a nurse, trusting that my patients, they're not intending to hurt themselves or others, or just having that mentality will help me provide the best care. I also think patient education was a big lesson I learned, especially from my time in postpartum. They had happier moms who were usually more successful with breastfeeding, and this taught me how important it is to speak understandably and use the teach-back method, and I hope to carry that into my future time as a nurse. Finally, one of my nurses had suggested that in future clinicals I make a note card where I write down what I know and what I want to work on. She said that this can come in handy in cases where the nurses have no idea where we're coming from and they see a lot of students. And I think it'll also come in handy maybe in lieu of communicating this verbally in times where you and your nurse just have things to do right after shift change at the beginning of the shift. So I really want to do this because I think it'll give me more opportunities to practice my skills and give my nursing scholars more trust in me, and hopefully I'll be able to do more and develop stronger relationships with them faster. Thank you.